Recording.
Welcome in, everyone. Welcome to Care Concierge with Care Patrol, where education is the heart of everything we do at Care Patrol. I thank you for being here. I know that most of you, or many of you, probably had to go to some effort to join us today because I made a mistake in setting up the class on Zoom. And so I appreciate those of you who made the extra effort, and I hope it's worth the effort. Today, we're going to discuss help with medication cost, presenting some new information, hopefully, to you, and I'll ask about that. As you know, and I know many of your names, as you know, we're credentialed by the Board of Social Work Examiners and also by the Board of Nursing for the state of Alabama, and these are reciprocal with most states. And we provide 1 hour of live or face-to-face credit hour for this session and all others that take place on Mondays and Fridays via Zoom. And then we have a YouTube channel, which is just Sean Barnes Care Patrol at YouTube. And there are all of our previously recorded CEUs on there that you can watch and let me know that you watched and take the evaluation, and you can get a recorded or an at-home study CEU for attending those. So as you may remember, those of you who've been with us recently, you have the ability to unmute your mic. So we do ask questions and try and encourage participation during these sessions, and certainly you are welcome to share your opinion or thoughts or ideas or concerns or anything at all for that matter via using your mic, as well as you can use the chat room if you prefer that. I have posted our evaluation link in the chat room where you can see it, and I will read it to you. Those of you who are not able to see a screen, the survey link today is https://www.surveymonkey.com/r/all uppercase letters W, D as in David, 8, M as in Mary, L, 5, P as in Paul. And I know that there were quite a few people who just joined us. I thank you for joining us today. It's Care Concierge with Care Patrol, where education is the heart of everything we do. We are a placement agency, meaning that we depend on referrals from folks like you who have clients, families, patients in need of knowledge about what lies on the road ahead for their care. We provide that guidance and education, and then if it's appropriate for community care, we would then tour that patient or family or client in various communities to help them make a firsthand educated decision. All of that's at no charge. We're paid by those providers who work with us. And I'm hoping that you may, as you come across folks, either in the grocery store or in your clinic, that you may remember us and refer us to folks who may need just some more help or more information, or maybe we can just help you by filling in that time that you don't have to have that discussion with your clients. We can have it for you. So Care Concierge with Care Patrol is our CEU series. I was just reading the link. So any of you who have joined who are going to do the evaluation and are not able to see the screen, I will read the link to you. I've also posted it in the chat room, which you are free to use for any reason at all, as well as unmuting your mic. The survey link is https:// thank you, Ashley. Ashley always does this for us, and I appreciate you. https:// www.surveymonkey.com carepatrol.com/r/ all uppercase letters W, D as in David, 8, M as in Mary, L, 5, P as in Paul. Now, this evaluation is password protected. So if you try and pull it up now, you won't be able to get in. We give the password out about 12:45 or 12:50, and often somebody is kind enough to gently nudge me to remember to do that. But I try and remember to do that, and we will give your password out later today. We'll be loading any nursing hours up to the ABN site for you. Social workers and nurses and anyone who does an evaluation will receive a certificate of participation. Here's a point to remember for social workers. I spoke this week with the Board of Social Work Examiners, and because our certificates do not have your name on them, you will need to keep the email that I send you with the certificate as proof that you were there, because in the email, it says very plainly, thank you for attending, whatever. And so that's just a point of reference for all of you social workers. Looking back, when you present these hours to the Board of Social Work Examiners, make sure you present the email, print the email and present it with it. So I wanted to get that out, and please help me remember to say that at every one of these sessions that we do. Just arranging things on my screen and we'll get started. So our objectives today in learning about help with medication cost, which you will be asked to evaluate us on, and you've been very candid lately, I have to say, in your evaluations, and I appreciate that because it's made me want to be better about adhering to these objectives. But our first objective today is to learn the size of the problem of unfilled prescriptions in the United States. And then secondly, we're going to share with you some sort of common options or ways that people might look to obtain prescriptions for less cost. And then lastly, and the bulk of this will be explaining to you a resource that we use and have found and hope to share called Needy Meds. And so I will ask you now, each of you in the chat room or on your mic, if you are aware of Needy Meds and have you worked with them before? I'd love to know. Thank you, Nicole, for making responding to my social worker whatever description. So no, thank y'all for answering. You're always so sweet to do that. It makes me feel like I'm oh, actually, you have heard of Needy Meds. Oh, good. Have you used it? Pretty much resounding no's, except for Ashley. I'd love to hear about your experience with it. So we know that too many patients forego needed medications because they cannot afford them. We know that, don't we? Do we all accept that as a truism? And what we see in a study that you can see on the screen, that was a CMS study in 2004, they asked folks who did not pick up their prescriptions why they did not. So 5% or 4.4% of the folks who responded, about 1.5 million people, said that they did not pick up their medications either because they thought it would cost too much, it wasn't covered by insurance. Well, really, that's it. That's 75%. 75% of the folks in that study in 2004. Of course, I don't have data for today, but I would assume it would fall suit, if not be slightly higher. They did not get their medications due to cost. And so we know, I think each of us, when we're presented with a disease state or a debility or a set of symptoms, we know that treatment begins with the diagnosis. So you cannot treat something you cannot name, or you do not know how to treat it. And what we find is that at least 5% of the time, one of the reasons for a treatment failure among the Medicare population, and you'll see it's an even greater number among the non-Medicare population, but we'll see that medication affordability is often unrecognized as the reason for the lack of compliance to the treatment plan that was set. And so when the person presents to you upon a follow-up visit and they have not gotten better, but perhaps worsened, perhaps then we should look at one of these underdiagnosed reasons for that, which is that either the prescriber did not ask the patient if they could afford the medication that was prescribed or the treatment plan that was prescribed, or the patients were naturally reluctant to admit that they couldn't afford the treatment plan the doctor had said. Instead, they would simply not comply. They simply wouldn't do it rather than say, I can't afford this. And I think that's a statement of our culture, really, the importance we place on material wealth and status. So I want to ask y'all, have you ever asked, or do you ever ask your patients or clients whether they can afford the treatment or the medication that has been prescribed? Oh, Darla, I love your comment. I suspect the need is underreported. I do too. Thank you for that comment. Nicole, you do ask your patient. Yes, it is a question in my assessment. That's terrific. So when you ask questions, oh, your clients tell us, oh, what would y'all say from a percentage wise of the folks that, because you're telling folks, and there are people saying to you, I'm sure, that they can't afford the treatment. So what would y'all say? How many folks out of 10 that you see would that be true? Would it be like 1 out of 100? And I'll let y'all think about that. I'd love to know what the results are when you ask that question, and the answer is no, I cannot, and what you do. So the Annals of Internal Medicine did a study, and they said that 20% to 30%, which is kind of a big jump, but 20% to 30% of prescriptions are never filled. And worse, 50% of the prescriptions for chronic diseases go unfilled, 50%. So there's a cost to all of us in this, and it's not just financial. It's not that the total cost is estimated at between $100 billion to $289 billion annually. Now, that's a pretty big stretch. 189 billion is kind of a big number, but I assume it's their methodology is the reason for the miss, or something else that they've included, or ancillary costs that one study didn't include. But what's worse, much worse, is that 125,000 people die every year due to missed medications, and I expect that a number of them are from that 50% higher up the screen who don't get their medications and yet have chronic diseases. According to the AARP, in 2019, 28% of pre-Medicare age adults do not pick up their drugs due to cost, 28%. So remember, Medicare recipients reported 5%, 28% of pre-Medicare patients. What does that tell you about the level of the economies there? So younger people have less disposable income than older people. So you would expect that a Medicare recipient would have possibly more resources to pay for medications than a younger, maybe working poor type person. Then, that's still shocking to me that 28% of pre-Medicare age adults do not get their medicine due to cost. So a 2020 bank rate survey that I found said that 32% of families delayed or deferred medical treatment and adherence to it in the previous year, so in 2019, due to cost alone, 32%. The Journal of Managed Care reported that the failure to fill rates are significantly higher among beneficiaries with psychiatric conditions, arthritis, cardiovascular disease, and emphysema or COPD. Now, only 2.5% of those that reported failure to fill lacked a chronic condition. Think about that. Remember, 50% of folks with chronic conditions don't pick up their medications due to cost. So y'all may remember, y'all may not, y'all are mostly young on the line, but some of you, like me, may remember the Surgeon General who served under President Reagan. He was controversial. His name was C. Everett Koop. And I think he almost didn't get approved by the Senate. But he was an adamant proponent against smoking, and much of what you see today around the inability of cigarettes to advertise or things of that nature date back to Surgeon General Koop. But he also had as a passion getting people their needed medications. And he said very plainly, drugs don't work in patients who don't take them. And we know that, don't we? So this is sort of the same question asked in a different way that you answered earlier. I apologize if it's redundant, but I wonder if you ever ask a patient or client on their follow-up, and I know for some of you it's part of your process, but on their follow-up, if they had trouble getting their medication or affording their medication. So I'm guessing that those of you like Brandy, who has an initial assessment process, would both ask the question before and after, but do you? That's a question I have. I don't know. Do you ever ask your patient or client upon follow-up whether they had trouble getting their medication or adhering to the treatment plan? Crickets. I must have put y'all to sleep. Oh, Ms. Scott, that's great. I'm in dialysis, and binders copays are sometimes $900 to $2,000. 50 to 65% of her patients need assistance. So she asks often, and Nicole, you do as well. Thank you. All of you do, I'm sure. So there are many ways to search for assistance, as we all know, and we're all probably folks who are Google users or have another browser we like. But these days, do you remember when we were younger and we would sit around and talk all night, and someone would ask, well, who played that role in that movie? Or, what happened, with the whatever? Well, back then that would keep us up for another couple of hours trying to remember. Now it's a 5-second search on your phone on Safari or Google Android or whatever you have. And so naturally, I think most of us these days would turn to the internet and the search engine to find ways in which we might somehow defer or delay or reduce cost. But kind of the issue with that is that it's hard to guess what are the right search terms. And it seems that no matter the combination that you use, the first page and the second page and the third page and most every page, it seems, is populated with the sort of ads that you see on the screen. And so they are very deceptive ads. Most of them are for drug cards. And others are for Medicare Advantage or Medicare Part D plans. You see one of the ads I clipped on the screen bills itself as a Lupron card. In other words, they present as if they are the maker of Lupron, but they're not. They're simply a drug card that has negotiated a reduced price on that drug. And so I think, again, it's deceptive advertising. And the fact is you don't even know that it's an actual company. That's where it's hard to find out. But you may get lucky, as I did. And you can see on the screen, there are some different disease-specific advocacy websites or nonprofits, and they will list different options. And one of the ones they listed was Needy Meds, which I investigated. And I didn't start with Needy Meds. However, unfortunately, I went through several pages of Google searches. And I did find, again, as I said, that there are websites that are specific to certain diseases. Or that they are the extension of a nonprofit or some sort of funding arm that serves a specific disease. And you can Google that disease and come up with them, perhaps, or you can go to the NORD site, which is the National Organization for Rare Diseases, NORD. And that website is https://rare diseases.org. And on that site, it lists all of the various other disease-specific resources. And so it's sort of in a way, a one-stop shop. If you have a young diabetic patient or someone older with COPD, and you think there might be some funding that's national or even regional or available statewide, you could find it on this website. And you might also come across a Medicare listing in your search. And if you go to medicare.gov, thank you, Ashley, for posting that for everyone. Ashley has posted in the chat room the NORD address. Thank you. You might go to Medicare, and Medicare, as we talked about on Monday, when we talked about Medicare Advantage or Disadvantage, Medicare is changing, and it is in essence privatizing. And when you go to the Medicare site for help with drug costs, it is little more than a clearinghouse for the various Medicare Advantage or Part D plans. And it is true that if you're on original Medicare, you will need a Part D plan for prescription coverage. Or if you forego original Medicare, most Medicare Advantage plans have an avenue for drug coverage, but not everyone that we help is Medicare age. And then, having a drug card at a time may be a better savings than getting onto a Medicare Advantage plan where there are other possible issues. So the Medicare site, to me, was not effective in trying to find the lowering the cost of drugs. So we've been through for the most part, Google search. What resources do you presently recommend to patients who need help paying for meds? Do you already have a disease-specific website or funding source? Do you already have some other vehicle that you prepare or propose to your clients for help? Or do you not know anything to do? What resources do you currently recommend to patients who need help paying for their treatment plan or their prescriptions? And I'll look forward to seeing your comments. Charitable pharmacy, says Darla Dean. There's a charitable pharmacy in our region, Ashley Tolbert. LIS will assist more than anything. Ms. Scott says. Nicole Clark says, medication-specific patient assistance programs. I just Googled them ad and put PAP at the end. That's smart. Thank you all for replying. The best resource and I'm sure that there are other people who are brighter than me and more educated who could find better resources. But the best resource that I found was called Needy Meds. And it is, in essence, also like the Nord website, a one-stop shop that lists programs that provide assistance. In fact, it lists over 30,000 programs. And they're divided in all sorts of ways, from national to regional to state to disease specific and on and on. And all the information on it is free. So it won't cost you or your employer anything to use it, nor will it cost your patient anything to use it. It's free. And in addition to the website, and really as a means of paying for the website and for it to be constantly updated, Needy Meds offers a drug card. And before you poo-poo the drug card, it supports the website, and it saves its users about $1.5 million every month off the cost of their prescriptions. And over the course of the life of the card, it has saved about $300 million. Now, Needy Meds was started in 1997, so it is 25 years old. And having saved $300 million, that's about $12 million a year saved for clients. That's pretty impressive in my book. They have some other things that they also provide, which is Be MedWise, and it has information on the proper use, storage, and disposal of medication. So any of you listening who work in hospice, you know that one of the issues in hospice has long been the disposal of medications upon celestial discharge, particularly scheduled drugs. So we're not supposed to put them in the water system, so we can't flush them. We can dump them out into cat litter, maybe, and then throw them away. But there's so few ways, and sometimes you're in a home where you don't have that option. And so BeMedWise.org, you could quickly search and say, okay, what can I do? How can I dispose of this? And then similarly, have a safe needle disposal website on how to legally and safely, but legally, dispose of your home generated sharps. And they have over 4,000 collection sites listed for those, which I have to search. My daughter has arthritis and gives herself a shot once a week. So I probably have 10 of these little sharp containers around my house because I don't know what to do with them. So now I do. Safe needle disposal. And then Find Care is maybe my favorite part of the site, really, because what it does is offer folks with the ability to locate free or low-cost clinics. And as some of you pointed out earlier, many of those clinics will also have a low-cost pharmacy attached. And so I want to ask y'all, well, I know I already know the answer from Ms. Clark, but for others of you, when you see a pharmaceutical commercial, and it seems like now is the time, doesn't it? It's about football season, and for some reason, pharmaceutical commercials seem to be in abundance during football season. And you always, at the end of them, hear the phrase that if you cannot afford your medication, so-and-so may be able to help. And I wonder, are you a jaded person, as I have been to date, and think that, well, they just say that, they don't really mean it? Or do you really believe that they help? Now, Ms. Clark, you cannot answer, but everyone else, do you think that they actually do help, these pharmaceutical makers? they help. Y'all know they help. And it's the Pharmaceutical Patient Assistance Program, or PAP. And it is funded by the manufacturer. And they provide free medications worth $13 billion over the last decade. That's interesting. Ms. Scott says that if you have commercial insurance, the PAPs help you more. I think that is true in some cases, but not in all, based on what I read. Now, you work with it, so you know more than I ever will. But most of the programs use a multiple of the federal poverty level to determine, the income cutoff for whether or not you can apply and receive assistance. But there are more than one. Many, in fact, use the number 400% of the federal poverty level. And some even have a higher limit or maximum. This is according to the Health and Human Services Department in 2021. So just so that you know, this could help many people, I think, who come to you. A family of 4 with an income of $100,000 would qualify for a number of PAP programs. Now think about that. There's got to be some percentage of your clients and patients who come in who fit smack dab in that description. Family of 4, $100,000 income. And you may have thought, oh, well, they make too much money. They don't. They don't. They may not. We don't know, but it's worth trying. So to answer your, not question, but comment, Ms. Scott, some of them, according to HHS, have the requirement that you have no health insurance. And then some say that you can have health insurance, but you can't be covered for the medicine that you need, which is why we would give you this assistance. And then some simply don't care. And then some, in Ms. Scott's opinion, actually prefer that you have health insurance. And so they differ greatly. And this is why I think having a resource that lists all of the PAP programs side by side and what they cover and how to access them, I think that's really a wonderful resource. So the problem then is folks who are on Medicaid, and even some on Medicare, cannot get help, or if they're on some other federal program like SHIP or something else, they would probably be barred, which is stupid, but that's the way it is. They do sometimes, PAP programs limit the age of the person who is to be the person who takes the medication, if the FDA recommends that someone at that age not take that or not take that dose. Now, others will say, hey, you can use off-label usage of this drug, and we will still cover it as long as the off-label usage is an FDA-approved usage for that diagnosis. And then some programs also limit whether or not you can receive assistance based on whether or not you are a U.S. resident. And so we see that in these cases, many of these folks who need the help cannot get it because they're either an immigrant or because they are on Medicaid. And so in my mind, even with this assistance, we're leaving the poor behind. So they all have their own eligibility criteria. And again, this is why I like having Needy Meds as a site, so you can sort of parse through, because there may be multiple options for getting coverage for a drug for juvenile arthritis. And so you may want to look at which ones are maybe better than the other. And even sometimes the same drug maker will have 2 different programs for the same drug. And so it's just hard to know on your own, in my opinion. The one thing that all of these PAP programs have in common, the one thing they have in common, is that they all require a prescriber. Now, what did we say earlier in this presentation? First have to have a diagnosis. And to have a diagnosis, you have to have a provider. So you can't even have a treatment plan that you're uncompliant with uh, if you don't have that. And so this is what I like about Needy Meds and about this site is that it has a listing of all of the low-cost clinics near you. You just put in your zip code, and it will show you all of the listings of free or low-cost clinics in which you can begin the process of treatment, which is secure a provider and get a prescriber, and then hopefully use some of these resources to obtain the medications or other, implement that you need to become healthier. And so I just clipped here on the screen and just to show you that in the state of Alabama, there are 311 free, low cost or sliding scale clinics. And a number of those, as I said earlier, have a full complex in which they may even offer mental health care, in which they have a low cost or no cost pharmacy, or in which they offer maybe pediatric care or geriatric care or mental health or whatever it may be. These clinics are not simply a single provider in an office. It's a network. And there are 311 in Alabama. That's really impressive to me that our state would have that much access. And I'm sure it's not enough, but to have that much access to low cost and free care, to me, gives me hope for our state. Now, the other thing that's kind of neat about Needy Meds is that they make you aware, and again, it's updated regularly. They make you aware of coupons or help with copay or rebate help that may be available on a particular drug or that may be offered by a particular drug store, like a CVS card, like the one I've shown. But Needy Meds can help you sort of clip, if you will, these various coupons and apply those to the cost of your drugs, or reduce the cost of your copay, or provide some rebate to you so that you may pay full price but get money in the mail. So these are another terrific way to lower our cost. And anyone that's lived on a budget knows that clipping coupons is very helpful. And then there's the diagnosis-based assistance page that I mentioned earlier. It contains 4,000 programs that provide help based on diagnosis. And of course, some are national and some are local. And then some of these diagnose-based websites will provide services like transportation to and from the doctor, or house cleaning, or assistance with getting the medication, or other direct financial assistance. And that's a pretty broad scope. So it could be something like a drive to a medical appointment, or it could be that you are a woman who has had chemotherapy, has lost her hair, and would like a wig. So there's a site that provides free wigs listed in Needy Meds. There are sites that list diabetic supplies. There's a site for nipple tattooing for women who've had reconstructive breast surgery. So the point of the matter is that it's a very diverse listing of options, even pet care for someone hospitalized. So I just, y'all can probably tell, I'm in love with this site and with all of the information that it shares. It even has a section on COVID-19. There are still services that were attendant or put into place during COVID-19 that have continued to exist, 400 of them, in fact. And they help with healthcare costs or medications or rent. And then there are, the medical transportation, and this could be even something like a gas card, or, for example, my cousin's daughter tragically died of cancer at 36. And she made many trips to MD Anderson, and all of those trips were paid in a fashion like this. And then they have an entire section within Needy Meds on recreational opportunities for people with chronic disease. A lot of these, as you would expect, are targeting children, so camps for children, but not all. Many of them include the family, and some are for adults. And there's a large number of scholarships that they make you aware of at Needy Meds, and this would cover not just the cost of going, but the cost of rooming there while you're there. Or if you are someone who works with a child who has juvenile diabetes, let's say, it's very possible that you could go on this site and find scholarship assistance or room and board assistance for them with college, or even adaptive equipment to help them go to college. Or, and here's the really wonderful thing, help in paying for someone to attend college with your child as a helper. Now, Needy Meds does list government health care programs, and I think this is a more helpful listing than the Medicare.gov listing, in that it helps people understand about things like SHIP counseling, or the federal poverty guideline, or help with taxes, Medicaid sites, assistive technology. We did a CEU some weeks ago with a gentleman who was blind, and that was fascinating. Cancer screening, nutrition programs. There's all sorts of things that the states and local governments and regional entities make available to us, and they're listed in Needy Meds. So I want to ask y'all, have any of you ever used a drug card? And if so, which one did you use? And if you used one, what was your experience with it? Positive, negative, neutral? So have you ever used a drug card, anyone? And if so, which one? And how did it work? What was the process? So you've used GoodRx, Nicole Clark. How was that experience? GoodRx, GoodRx. GoodRx laid off 8,000 people yesterday. Did y'all know that? It was good? Yeah. And here's why. I looked at developing a drug card during COVID when my business and others came to a halt. And I was working with a PBM. Do y'all know what a PBM is? A PBM is a pharmacy benefit manager. They are sort of the middle man, if you will, between the pharmacy and the health insurance company. The health insurance company employs the PBM in effect to reduce the cost of drugs in the health plan. And then what the PBM does is they go and squeeze the local health, local pharmacy out of their profit in order to make profit for the healthcare plan. This is one of the reasons I'm not a fan of PBM so much, but I had a plan sort of like this, that I could create a drug card that would create a foundation for people needing care, which is what I do, CarePatrol. And so I was down the road with a PBM, and what the PBM does is they provide sort of the software that controls the flow of cash for that prescription. And it's kind of complicated, and it's too much to get into here, but I had that person on the hook. We were looking at moving forward, and then in 2020, maybe 37 states outlawed the process of rebates. This is where the drug card made their money, was the rebates. So the drug card, for example, would provide you with reduced pricing on drug A. And at the same time, the drug card would go to the wholesaler, let's say McKesson, who has a lot of the wholesale. And they would say, look, we're going to promise you that we're going to sell this much of drug A because we're making it, amenable to our clients. And then in return, we're going to get the rebate that you're going to offer. Well, they cut that out. That's where these people make their money. So GoodRx, in my opinion, is on borrowed time because their process is in effect outlawed in more than half the country. The reason I asked the question, Ashley, as to whether you've used a drug card is just to talk again about this Needy Meds drug card, which works the same way as all other drug discount cards. But the end result has a better outcome, in my opinion, and that they are taking money to put into place to help other people. And even if you use the Needy Meds card or the Good RX card, you might, if you're a card user, keep several cards on you. And that would be what I would advise my clients, because you never know which card is going to have the best price on which drug. And that's not something that it changes. Pricing of drugs changes weekly. So the cost of the drug you pick up may be different today than last week because it's a different generic maker, for example, or because the drug cost was reduced over that week. Who knows? Now, the cards we've already said can't be combined with insurance, and the savings vary. Now, this card, as I said before, and this is an example of it on the screen, differs from others in that the monies go to Needy Meds website, and it keeps the expenses low. They have 30 employees, y'all. It's quite the operation. So to fuel 30 people and this website and all these changes and all this information and the vetting of all this information, they have a drug card, and I want to encourage y'all to use it. That's why I'm bringing it up. And you can go to needymeds.org. Now, I missed something, y'all, which was earlier on the question screen. I should have put the code word, or I did put, but forgot to mention the code word for today. And I put it now in the chat room. It is Needy Meds. It's all one word. There's no space between needy and meds. Needy Meds with a capital N and a capital M. Needy Meds. That is the evaluation password today. So again, just to wrap up, Needy Meds, 12,000 people visit www.needymeds.org, y'all, not com, .org, 12,000 people a day, 30,000 programs in the database. And all you got to do is go to needymeds.org and click on healthcare savings, or you can call their toll-free helpline and they can talk with you about specifics if you have a question. They get about 4,000 to 6,000 calls a month. That's a big call center, y'all. That's a big call center. So they are an entity that is poised and prepared to help. And while there are other means and ways of saving money, as you all know, and thank you for your many comments, Needy Meds to me is one that I wanted to make you all aware of. So if you know someone that's having trouble, a patient, client, family member, friend, neighbor, suggest they go to that site, or go to that site for them, help them out. So our CEU code word is Needy Meds. We're finishing early today. Happy Friday, y'all. And by the way, we will be here on Monday, because although I hope to make no more technical errors like today when I canceled this meeting and you all had to find it and reschedule, I hope to make no more technical errors, but I did book a CEU on the same day as Labor Day. Now, I hope all of you are on a boat or in a park or in bed taking a nap or doing whatever it is that you want to do on Monday, because I hope you take a holiday. But if you work, I'll be here at noon, and I hope you'll join me. We're going to talk about dealing with grief on Monday, which is Labor Day. So our code word today is Needy Meds, all one word, capital N, capital M. Please complete the survey by 8 o'clock tonight so I can get the CEU certificates out to each of you who complete the evaluation tonight. And the nursing hours we will load sometime next week. Social workers, everyone will get a certificate. And social workers, once again, with our certificates, when you turn them in, also print the email that came with the certificate and present that to the Board of Social Work, And they will use that to determine that it was live and that you were here because the email says, thank you for being here. So last time, anybody that missed it, SurveyMonkey website, https://www.surveymonkey.com/lowercase r/ all uppercase letters W, D as in David, 8, M as in Mary, L, 5, P as in Paul. Thank you so much for being here. Thank you for all that you do. Thank you if you're working Monday, because it's because of people like you that people like me are healthy, and I appreciate you. Have a great weekend.